It was back in 1989, after 5 years of going through intensive medical education at the Addis Ababa University Medical Faculty, that I became one of the few medical interns. Wearing my gown and hanging my stethoscope around my neck, like most senior doctors do, I felt so proud of myself. I felt so enthusiastic, and it seems as if my addition to the pool of medical doctors would change the landscape of health and disease. And when I was first assigned as an intern to the gynecological ward, I made this first round with the senior gynecologist and the residents, and we went to the room labeled septic abortion. As we entered the room, I saw rows of beds, 8 to 10 on each side, and on each side was a girl fighting for her life. A girl that had undergone through backstreet abortion and arriving at the hospital losing so much blood and having serious infections. The fragile bodies of these girls lying on the beds, IV fluids attached to their arms, oxygen masks covering their nose and mouth, each one gasping and fighting for her life, and parents and relatives in the back frantically crying and chanting prayers. This tragic situation changed me deeply at my core. For the first time in my life, I felt guilty. I felt guilty because of the sheltered life I had enjoyed. And I was oblivious to the untold sufferings my community, my peers were undergoing. And I felt angry at the same time because this was a preventable situation. Because I came to realize that what is driving this is the underlying injustices and vulnerabilities that these women have to go through in their lives. When I was born, it was such a joyful occasion in my family. But for many girls, birth heralds the beginning of discrimination because girls are considered as less worthy and are unfairly discriminated than boys. When I was 6 years of age, I was already in grade 1, having lots of fun, playing high jump with my friends, while girls at that age in the rural communities, in the urban slums, are burdened with taking care of other siblings. And when I was age 15, I was already deep into my studies and in high school, while girls, many girls in my own community are forced to drop out of school and to get married to a man they have never seen before. And their first sexual experience is a coerced experience. And these girls have to travel several kilometers barefoot to fetch firewood and to collect water for the household, and they work from dawn to dusk. And when I was 23 years old, I was already an intern and looking forward to embrace good life, while girls, as I told you, are already in the end of their life journey, too young to die, and the loss of so much talent and goodwill. I chose to marry my husband and when to marry him. I chose when to get pregnant and decided the number of children I wanted to have. I chose and decided the type of contraceptives I wanted to use. And I strongly believe that these choices, these life-critical decisions, should be made available to all girls and women, regardless of where they live. And that is why I work in women's health, and that is why I'm committed to represent the voices of those girls in the gynecological ward, and I am committed to do so until the time when sexual and reproductive health quality services are available to each girl and to each woman, and their rights is protected, respected, and fulfilled. I thank you. Thank you.